Remember, we've said, just imagine you've come through for a consultation. Now, let me pick another marker. Yes, let me use blue. Just imagine you've come through for a consultation, and which procedure you want? You need to do a breast reduction. I don't know whether you are seeing me right here. Let me use this side because I'm a right-handed guy. Now, for those that would want to know, breast reduction is a procedure that we give out to reduce on the breast tissue or to reduce on the size of the boobs that someone might have in the very first place. Now, here's where a person that is going to do a breast reduction benefits from. A person who is going to do a breast reduction will benefit twice, in a way that when we are doing a reduction, yeah, in the same way we do a lift, there is no way we're going to do a reduction alone and we do not lift your boob. So a person that comes through for breast reduction will benefit twice. You won't pay again for a lift because you'll achieve two things at the same time. Yeah. So breast reduction, we've said we just take out breast tissue. We reduce on the amount of breast tissue that you have. At the end of it all, you'll have a reduced size of the boob. You'll have a different shape of the boob, and we shall have reduced on the breast tissue that you have. Now, for a person that comes through for a lift, we shall not reduce. We will only lift. So you find that we won't touch on the size of the bulb that you have or the size of the bulb that you come with. We shall just lift and reposition the nipples. Now, what you should know about a breast reduction, or what should you know about a breast reduction? A breast reduction is done to people that are experiencing the following. You can have what we call medical related issues. Yeah, or you can have cosmetic related issues. Yeah, so these are the two people that will come through for consultation, or for the people that will come through to do a breast reduction. You'll either have medical related issues or you'll have cosmetic related issues. Let's break them down. For medical related issues, we all know that people that have history of cancer cells, yeah, will prefer doing a reduction in a way that we shall have reduced on the number of or on the amount of breast tissue that you're having as a person, hence reducing the risks of you having breast cancer in the nearby future. And then we also people that have big boobs, you well know that you get irritations, yeah, skin irritations beneath the skin or below your boobs. When you try to lift your boobs like that or like this, your skin will be irritated and you'll develop some kind of rashes. As to some extent, those rashes become itchy. And if I mention about a point that you are really going through, you just be like, oh. So you find that it doesn't only develop rashes, but they will end up, the skin will end up becoming itchy. Then we have back pain. For people that have big boobs, the fact that there is too much breast tissue, it will be too much, okay, the boobs will carry too much weight compared to the rest of the body parts. So you'll end up always complaining of the back pain. Yeah. Another thing we have shoulder pain. Yeah. So for the shoulder pain, still it is related to the weight that is really that comes with the boobs that you have as a person. As a result of you having too much weight on here, the shoulders will be the ones bearing the weight. You'll be tasking the shoulders the more. So as an end result, you'll always be complaining of shoulder pain. Then we have what we call posture. Yeah, or there will be change in posture. This comes about if you have too much breast tissue. If you have big boobs, you all know that definitely your posture will change in one way or the other. You'll bend inwards. So that means for a person that has been always moving straight, now for you who is having big breast tissue or big boobs, I would say, you'll end up acquiring a different position. Actually, it might come up ngagwetomanyi. You might not know that you actually changed shape. For those that know, they really know what I'm talking about. So there will be change in posture simply because of what? Big breasts or big boobs. Let's cross over to the cosmetic ones. Now, for the cosmetic reasons as to why a person would come through for breast reduction or a lift, you are limited. People that are limited from certain kind of clothes, yeah, this will be a person because there is a specific type of cloth that you want to put on, and it requires someone with small boobs. You'll end up leaving it out, so it will limit you on the clothes that you to put on. And you know, this is a generation, this is an era whereby a certain type of trends of clothes come through, and as a girl child, you'd want to really experience that life and you want to put it on, but because you have big breasts, you won't be able to. Yeah, they only made them for people that with small boobs. So you are left out. For people that would want to look nice, just type into the comment section, look nice. You know, it comes with trend. There are people that prefer a certain shape, and you know, your body is supposed to be proportional. Yeah, your body is supposed to be balanced. Now you find a person that is slim having big boobs, so you might end up not liking the person you are or the shape that you have as a person. So that person we end up telling you to come through for breast reduction such that will reduce on the size of the boobs and you rock. Yeah, you rock as a person. Then we have also it is uh, it has sexual benefits as well. Now, this only comes to your partner. Let's say for the married people, you find men that do not want big boobs. Yeah? Men that do not want big boobs. So such a person will send through a wife, or the wife herself will carry the body to the hospital to carry out a breast reduction, such that omuntu ng'oyo mu budget yani y'omusajja, or the person or the wife makes the husband happy during these things. So these are the people that should come through for breast reduction. One, we said if you're a person that is experiencing back pain, shoulder pain, it changed your posture. Then for people that were experiencing skin irritations, yeah, and for people that would want to put on certain types of clothes, for people that would want to look a certain way, yeah, you want to be all balanced. You're small and you want your boobs to become smaller as well. You want to put on certain types of clothes, yeah. And also we have some people that do not want to put on bras, yeah, people that wouldn't want to put on bras. So you see, people with big boobs, you'll always be required to put on a bra, and the bras have they end up bringing shoulder straps. When you take off clothes, definitely someone will see where a bra was going through this side and this side, and most people do not want them. Yeah, so the bras cause shoulder straps that come around the body, which really makes you look a little different. So people that do not want to put on a bra will end up opting for a breast reduction to be done. You get that? So having seen all that, yeah, this procedure we do it. There are two approaches that we use. We have what we call a lollipop, and we have what we call the inverted T. A lollipop looks like it's actually a lollipop, a sweet that like that. Just go around the nipple and then exercise downwards. Then we have another approach which is called the inverted T. And I think you've been seeing most of that in all the videos that you've been seeing. So this can be used for people that do not have excessive breast tissue. If your boobs are not that bigger, then this, we prefer to use it on people that have really big boobs. So if you come through you'll end up having this approach. If you come through, your boobs are not that big, you'll end up having this kind of approach. Now, for people that want to do this kind of procedure, I want you to register one thing, that if you ever want to do anything on your body part, just know that it carries risks, side effects, or what we call complications. If you ever want to do anything on your body, let it be hair planting, let it be hair piercing, let it be tattooing, let it be any kind of surgery that you'll ever want to do on yourself, it carries risks, it carries side effects, it carries complications. And that's what I'm going to tell you right now. I'm going to take you through the effects, the side effects, the complications, the risks of doing a breast reduction. When I mention a breast reduction, definitely you should carry them to the breast lift. You get what I mean? Before we cross over to this, I want you to know that we do this procedure through general anesthesia. There is no shortcut to that. Why we prefer general anesthesia? Because you sleep and wake up when everything is done, giving you a chance to really live a life that is out of trauma. We didn't traumatize you. Yeah, you don't remember anything about what happened. You just come in and end up moving out with the results you came through. So we do it under general anesthesia if we are to carry out a breast reduction. Now let's go into the risks, the side effects, and the complications. One, we have what we call pain. Pain is one of the known one of the side effect, one of the risk that you should know about the procedure that you want to do. Now, pain, we try our level best to really take you out of pain. How? In the very first place, we shall do it under general anesthesia. That means we want to really exclude you from feeling anything called pain. Then, even when we are done with the procedure, we shall admit you. The days that you're going to spend with us on ward, we shall be giving you painkillers. We are doing all these things in a way to eliminate pain. Even when we discharge you, for example, you've stayed with us for that period of time, we shall definitely say, now you are fit to go home, but still on pain killers. So you see, there is no way you're going to really feel pain, however much. Pain is one of the known risk that you should register. Then another thing, we have what we call bleeding. Now, for the bleeding, the fact that we're going to touch healthy tissues, we expect them to bleed. Just take an example. If you got a razor blade and cut your skin like this, you'll bleed. How about the brush that are supplied actually with blood vessels that supplies blood? Yeah. So if we cut you, definitely we shall bleed. But what do? We have a machine. We call it a diathermy machine. This diathermy machine has two functions. It cuts, at the same time coagulates. Meaning, if we cut and we cut a vessel that is actually, we cut those tiny vessels that will be in case we come across it and it's cut and it starts bleeding, this machine immediately coagulates, or it stops the bleeding. That's why it is very, very, very important in all the procedures that we are to do. We can't actually do without it, because it helps us on reducing on the risks of bleeding. So we try our level best to really control the bleeding part. However much, there's some other investigations that we shall do in order to prevent ourselves from overbleeding. For example, when you come through, we shall do the assessment. We shall do a CBC. Then we get to know your HB levels. Yeah, we also get to know how your cells are doing. We rule out any kind of infections. So by the time you get onto the table, you are literally ready to have the procedure done. Then another thing, you can talk about hematoma formation. Hematoma formation, that is to say, if there was bleeding in the very first place and that blood collects in one place like this, it will solidify. When it solidifies, it will form a hard lump in the boobs. Now, for some people, we get to detect just a few days. Within the days that we keep you around the hospital, we are able to note that a hematoma was formed. But what do we do to really prevent this from happening? We tell you to get a compression bra, or you call them compression garments, wherever you can name it. So for all people that have come through, you well know that we can't do the procedure without a compression bra, without a compression garment. So this compression garment is supposed to apply pressure. When we are done with the procedure, it helps us in applying pressure. You all know that if you cut yourself and you're bleeding, the first aid that you can give to yourself is applying pressure. So it's the same thing. This compression bra has a lot of functions. That is to say, it will prevent the bleeding. In preventing the bleeding, it will also prevent the hematoma from forming. Then the other thing is it will keep the boobs in one position. It will position the boobs steadily in a way that they are not, they are kept constant. Because remember, when we, for example, if this is your boob, we created an incision. What keeps this part and this part together are the sutures. Yeah, the sutures that we put in are the ones that keep, you can call them wounds, the incision sites are closed. So if we do not apply pressure, you will end up leaving the boobs alone and free, which will end up giving, the boob will end up giving way. The incision site will gap. And when it gaps, it prolongs your recovery period. So what we say, compression bras, compression garments are really important things for you to have because one, it will prevent the bleeding, it will position the boobs in one place, preventing the gapping, the hematoma formation, and also we have what we call seroma formation as another one. Now, seroma formation, it simply means fluid accumulation. Fluid accumulation, for those that know or for those that do not know, once we take out the breast tissue, there will be space left in there. What helps us not to form this liquid? Because the body will detect that space as a space that needs to be filled up. What will it do? It will start withdrawing fluid from surrounding tissue, filling this space that it detected. What do we do? A compression bra plays a part because it applies pressure, eliminating that gap. But we go on to put in drainage tubes. These drainage tubes, the main function is to drain out any kind of liquid that would form during the period that we're going to keep you around the hospital. So seroma formation is something that is really preventable if you really cooperate and move with us. So we put in drainage tubes. On top of that, we give you compression bras that you're supposed to put on as a person. Then the other one is infections. This is a part that we try our level best to prevent because we shall give you, let's say, antibiotics. Even before we go into the antibiotics, we shall make sure that the field is kept sterile. Yeah, the field will be kept sterile. We put on those gowns that most of you refer to as we do not iron them. Yeah, those gowns that you already say, "Lwaki tebagolola, lwaki tebagolola." So we put on gowns, we put on surgical gloves, we use the incontaminants, we use disinfectants, that is to say, Savlon, iodine. All these solutions are supposed to really kill the microorganisms that would be on the surface. Our skins are surrounded by microorganisms because someone is going to ask me, but I'm in theater, where did I get them from? Our skins all over are having microorganisms. So when we cut. Yeah. However much we try our best to clear them off with the solutions that we used in the first place, we might not be 100% sure that everything was cleared. That's why we go on to give you antibiotics. These antibiotics are supposed to clear even the small ones that would have crossed over to the inside. It's a normal thing for you to have microorganisms. The normal floras on your skin. That's why when you go to shower and you try to wipe yourself with a white towel, definitely it will get dirty. Why? Because you have microorganisms that are normal floras that are supposed to keep and protect you, protect the skin. But once they cross over from where they're supposed to be to the inside, that's when they become a problem. So we give you antibiotics. There is one specific type of an antibiotic that we prefer as a choice in all these cosmetic procedures. When you come through, you definitely get to know what it is. Yeah. So we give you the antibiotics that really help us prevent infections. Then the other part would be scarring. Scarring is something that you can prevent as a person, but by the time you want to do a breast reduction, definitely you will know how your skin reacts to trauma. That is to say, if you're a person that forms hypertrophied scars, you get to know that I'm a person that forms hypertrophied scars. If you're a person that forms keloids, still you'll know that I'm a person that forms keloids. If you're a person that doesn't form anything at all, still by now, you should know that you do not form anything. Yeah. So if you're a person that forms hypertrophied scars or keloids, at 6 weeks, there is a medication that we introduce that stops the scars from growing, and it also clears the ones that would have formed in the very first place. Yeah. So if we use the inverted T, your scars will definitely be ta ta. If you use the lollipop, it will be ta ta. For some people, they disappear completely and they do not get to see any kind of scars forming on their skins because their skins are so nice when it comes to scar formation. Then another thing would be loss of nipple sensation. Loss of nipple sensation, I mean, for some people, they might lose sensation around the nipples either temporarily for some few days or permanent. So it's either temporary or permanent. You get to know after the whole complete recovery period of 6 months that my sensations disappeared. There is a solution to that. That's when you'll come back to do PRP sessions to really stimulate nipples on nipple sensation, yeah, to bring back nipple sensations. If it's temporarily, you just spend about 2 weeks without having them, but after that, they'll start coming back, mpola mpola. Yeah, that is for sure that after the procedure, you definitely not have sensations. They will be off completely. But after a period of time, they come back slowly, slowly. Then we have rare complications. We have the rare ones. So all these complications that I've given you, all these risks and side effects I've given you, it's not a must that when you to do a procedure, you definitely have them. These are a must know, but it's not a must that you're going to have them or you're going to actually complicate. Yeah, this is information that you need as a person. Even when you do not come to work with us, you go to another facility, it will be the same information shared. Even if you go to Turkey, it will be the same information shared. Even when you go to South Africa, same information shared. Dubai, same information shared. So it's not a must that you're going to get them, but it's a must know for you. Things that you should know before really doing such a procedure. Then the rare complications that we have nipple, loss of a nipple. Loss of a nipple, have I ever seen it? No. Does it happen? It has ever happened. Here says I've never for sure. This is a guarantee that I'm going to give you. I've never seen someone losing a nipple after breast reduction. However, People say that it happened, it used to happen. But now the kind of approach that we use, we really make sure that we secure the nipple with enough breast tissue that will provide continuous blood supply even when we are done with the procedure. So I've never seen anyone losing a nipple in all the procedures that I've done, but it's something that is known. However much it's what? Rare. Yeah. Then we have difficult in breastfeeding. Once you do a breast reduction, you might produce little or no milk when it comes to breastfeeding. Why? Because we took out most of the breast tissue. How I wish we had a machine that could definitely detect that the kind of breast tissue we are taking out, it is the one carrying the mammary glands. You all know that mammary glands are glands that are supposed to prepare your boobs or your body for breast excretion or for breast milk production. Yeah, they're supposed to prepare yourself or your body for breast milk production. So if you do not have enough, you might find hard time in producing in producing milk. Yeah, so it's something that is known. If it happens, well and good. Now you start looking at supplementary feeds. You start giving other foods, introducing other foods to your baby once you give birth. For you as a person, you definitely detected that I've ever done a procedure back then that is maybe giving me hard time in producing milk. Then another thing that you should know about the procedure that you want to do, we are still on a breast reduction. It would be asymmetry. Yeah. Asymmetry means if there are two boobs, boob A and boob B, yeah, we take out breast tissue from boob A and we take out breast tissue from boob B. The healing from both sides might be different. Boob A might heal better than boob B in a way that size A might come out smaller than size B. If this thing happens, there is always what we call recur or revision surgeries. Yeah, surgeries that are done to correct the two sides to make sure that boob B is equal with boob A. It's not your fault, it's nobody's fault, just the body healed differently, ending up with two different sizes of boobs. Yeah. Uh, so having that in mind, I think that's all I have to say about a breast reduction, really. In case there is anything that I've forgotten, you have my number it's in bio 0785 26 32 75. This is my number 0785 26 32 75. For those people that are out of the country, you just do 2 plus 256 785 26 32 75. Come into my inbox. We shall talk more about the procedure that you want to do. Then the other thing for you to know about the procedure that you want to do, how many days do we keep you around the hospital? Between 3 to 5 days. Those are the days that we shall keep you around the hospital. After we've discharged you, we see you after 7 days. So you have a 7-day review after the procedure has been done. Then the other thing that you should know about the procedure that you want to do, before we do it, we carry out what we call an ultrasound scan. This ultrasound scan is supposed to really definitely rule out tumors, yeah, or lumps in the boobs. Once we find them in, that means we first have to deal with the lumps. We get to know whether they are cancerous. Doing this, we are trying to rule out cancer or cancer cells. Yeah. So if we find them in, that means you'll have to first exclude them and then later on come back. We do a reduction. So basically, I think that's all you need to know about a breast reduction. In case there is something that I've forgotten, you let me know or you come into my inbox, ask your questions. I'll definitely answer you. I'll be glad to answer you really. So my name is Ricky, and I think I've come to the end of this session. Uh, I've actually exhausted each and every information that you need as a person. So don't be that sit on yourself. It's no longer trend for you to have big boobs. Yeah, it's not a trend for you. Come have that surgery done and reduce on the boobs that you have. You have a size that you've always wished for. It's no longer trend. Newankubadde babakolera shaka 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 shaka. Come and shaka with small boobs, nyabo. Yeah. So come and shaka with small boobs. So if you're a person out there that is tired of big boobs, you have a solution. You can do a reduction. And if you're a person that really lost your boobs fail. Eh? These days you call them fallen soldiers. You can make them stand once again. You can make them salute once again. If it was something like this, yeah, it can come back to this with just a procedure done. Now, I think that's it. If there is anything that I've forgotten as a person, I'm not a computer, but in case you come into my inbox, I'll definitely take you through. Thank you very much. If you've watched me from the beginning to the end, I sign out for now. My name is Ricky. Good night.